Hi everyone, we are getting ready to go live here. If you're just joining, stick around. Got lots of interesting stuff to talk about today. So I'm waiting here to see all my streams go live, and then after that we will get started. So let's see what's going on here. I think we're live. We're live on YouTube, so we'll get started. So good evening, everybody. We're almost in the middle of January, believe it or not. My name is Donna, Imam, and I'm running for U.S. Congress in Texas's 37th district, which is a brand new district in Austin, Texas. We'll talk a little bit about our campaign at the end of today's stream, but let's talk about the big news this week. So we're going to talk about what happened with respect to vaccine mandates. The Supreme Court ruled on that today. It was a huge piece of news. We'll talk about voting rights, something that has been talked about in a big way among the Democratic Party, and it's kind of come to a tipping point on where it's going to go. And of course, the Biden poll came out today that people also talked about. So this is actually today, the 13th of January, is the first YouTube stream of the year for our campaign. As you know, I've been doing these since mid last year in 2021. And what I realized is that, last week on Thursday, usually I do this without fail, 7 p.m. Central Time, Thursdays. Last week I wasn't able to do it because we had a conflict with a Democratic club meeting here in Austin, Texas. So Austin has a sizable number of Democratic clubs. And of course, they're all getting together because there are many, many contested Democratic primary races and learning about the candidates and what their platforms are. And so, of course, we're very delighted and excited to participate in all of them and get our message across to some of the most informed voters across Austin, Texas. So that's kind of why last week's live episode on YouTube didn't happen. Now we have had 2 live Twitter spaces since the start of January, and as you all know, I host a Twitter Spaces 9 p.m. Central Time on Mondays. Every Monday, where you can come in with your questions, comments, and your solutions to our biggest problems that we face. So we have had 2 of those, and I'll bring up some of the things that came up in those Twitter Spaces. But let's get started on today. So the big news today, obviously, was about the Supreme Court ruling. Now, there is something interesting about this ruling. First of all, the Supreme Court actually blocked Biden's vaccine or test mandate for large private companies. So if you recall, if you were a large corporation with over a certain number of employees, you would be required to either be vaccinated or test regularly on a weekly basis. Now, we've talked a lot about lot about testing over the past several weeks because there's been a huge shortage of testing across the country. We saw huge lines of people standing to get tested as the Omicron variant spread very rapidly among the American population over the past 2 to 3 weeks. And that was it was a pretty dim Christmas for a lot of people. So the interesting part is that they did shoot this down, but at the same time the court upheld regulation issued by the Centers for Medicare and Medicaid Services that mandate vaccines for almost all employees, nursing homes, and other healthcare providers that receive federal funds. So it is an interesting contrast in the sense that in a 5-4, the CMS case to uphold mandatory vaccinations for Medicare and Medicaid providers was upheld, basically. And the court's 3 liberal judges were joined by Chief Justice John Roberts and Justice Brett Kavanaugh, as you can see. It's interesting that they refer to Supreme Court justices as liberal versus conservative because the Supreme Court is not supposed to be partisan, quote unquote. But it's very clear that it is partisan right now, and that is why you see these terminologies, conservative versus liberal. So the part about the healthcare workers was that the court said the vaccine mandate for healthcare workers was, unlike the OSHA regulation, justified as just the kind of detailed regulation for the Centers of Medicare and Medicaid Services has long imposed as a condition for healthcare providers getting federal funds. So they're saying that the reason that they upheld it for healthcare workers is because they are getting federal funds, whereas private companies, quote unquote, are probably not getting federal funds. But we know that's not technically true, but they're not given in the same way, obviously. So that's the distinction they're making. In addition, the court said that the regulation serves to protect patients from being exposed to greater risks when they're in hospitals, nursing homes, rehab facilities, and other areas, and medical providers. So what this leads me to believe is that if you read the article, it is interesting to see that they've upheld one of them and shot down the other one. There's a very good chance that a different lawsuit will come in order to remove the mandate for healthcare workers as well, a different kind of lawsuit. So as these were, it seems like brought together, one was upheld and one was basically blocked. But that's where we are with respect to vaccine mandates right now. In terms of, the virus spreading, it's I think this is a time where a lot of people have gotten the Omicron variant. It seems to be spreading very rapidly. So this dual sort of mandate decision, yes for one segment and no for the other segment, seems to be tied around federal dollars specifically. So it'll remain to be seen if this gets further fought in court. So with that, let's talk about voting rights. So we ended the year in 2021, if I can remember correctly, with the Build Back Better bill failing to pass in the Senate and being severely gutted in the House. And then the big conversation out of Democrats is that our democracy at stake, if we don't get voting rights passed, we won't have anything to even vote for. So all of today, this is the 13th, not a lot actually happened in the last 2 weeks, to be frank. But you can see here that the two things that were trending today, and this is just earlier this evening, was the Supreme Court's news. And of course, number two, Kristen Sinema says she supports the John Lewis Voting Rights Act, but will not support changing the filibuster rules. So the outcome of that remains the same. If you support the bill, but you don't support removing the filibuster, obviously you don't have any results for the American people. So what happened after that? So both Senator Manchin and Senator Sinema vowed not to kill the filibuster after meeting with President Biden. So it really looks like it's a no-go here. So let's read this article because it's a really interesting one. Joe Manchin reiterated Thursday evening, which is today, that he would not support scrapping or softening the legislative filibuster shortly after President Biden huddled with Senate Democrats in an effort to win support for changing the procedural tool in order to pass major election reform legislation. So the bottom line is that even if you support these voting rights bills and the filibuster stays intact, you don't really have a way of passing it because the GOP will not come on board. And the reason the GOP will not come on board is very clear, because they have spent decades gerrymandering state by state by state, figuring out how to have a trifecta in many, many states around the country to make sure that they stay in power, because they can very clearly see that they don't have a solution for healthcare whatsoever. Not lowering the cost of healthcare, not improving the quality of care, not about getting coverage to people. The GOP has no solution on healthcare, okay? They have no solution to lower the cost of education. They have no solution to improve the wages for working Americans. So if you don't have solutions with respect to policy, then how do you keep winning elections? You hold on to the power, you find other ways to hold on to the power. And they've done that very strategically, both through the Supreme Court of the United States, as well as through gerrymandering state by state, because they know that they can, if they have the power state by state, that they will have the power then at a federal level too in many cases. So with respect to holding the House, for example, if you gerrymander states to the extreme, now you've advantaged yourself with the number of people in the House that can be, voted in as GOP members versus Democratic members. So you see where I'm going with this, that there's absolutely no incentive for the GOP to join in passing voting rights legislation when they have gerrymandered and partisan gerrymandering specifically was completely gutted from the 1965 Voting Rights Bill in the last decade, right? So now we have a situation where we have, Joe Manchin and Kristen Sinema saying, "Hey, we support these voting rights bill, but we don't support the removing the filibuster." And that means we need to collaborate. We need bipartisanship. But the fact is, why would the GOP want bipartisanship when they can have full control and power over the American people? It's illogical, right? So it goes on to say that Manchin released his statements hours after his fellow moderate, I'm not sure if Kristen Sinema would be considered a moderate anymore, spoke on the Senate floor and reaffirmed her own opposition to changing the filibuster rules. And she says, we must address the disease itself. And she says the disease is not a problem of voting rights. The disease, in fact, is division. It's division. It's a difference of opinion, which is why the division comes. And so that's the article. I'll provide the article. But let's listen to a clip of her address to the Senate today.
I share the concerns of civil rights advocates and others I've heard from in recent months about these state laws. I strongly support those efforts to contest these laws in court and to invest significant resources into these states to better organize and stop efforts to restrict access at the ballot box. And I strongly support and will continue to vote for legislative responses to address these state laws, including the Freedom to Vote Act and the John Lewis Voting Rights Advancement Act that the Senate is currently considering. I support these bills because they strengthen Americans' access to the ballot box, and they better ensure that Americans' votes are counted fairly. It is through elections that Americans make their voices heard, select their representatives, and guide the future of our countries and our community. These bills help treat the symptoms of the disease, but they do not fully address the disease itself. And while I continue to support these bills, I will not support separate actions that worsen the underlying disease of division infecting our country. The debate over the Senate's 60-vote threshold shines a light on our broader challenges. There's no need for me to restate my long-standing support for the 60-vote threshold to pass legislation. There's no need for me to restate its role protecting our country from wild reversals in federal policy. It is a view I've held during my years serving in both the U.S. House and the Senate, and it is the view I continue to hold. It is the belief that I have shared many times in public settings and in private settings.
And there you go. So the disease is of division. The disease is not really about voting rights. It's about division. It's about bringing the GOP together to support something that will require 60 votes. So Democrats obviously don't have 60 votes in the Senate. They have nowhere near it. And Senator Manchin and Senator Sinema, I don't believe, have a plan to bring on another 10 Republicans or GOP senators to support any of these bills. So the path for voting rights legislation at the federal level seems very dim. And this is a really important, an important thing for Texans specifically. In Texas, we have a GOP trifecta. So the GOP has all of the leverage over our legislation. They use 2021 to further restrict voting rights in Texas, number one, in a big way. And make it more difficult to vote, specifically helping others to vote, specifically voting by mail. In Texas, you can vote by mail if you are 65 and over, or you have a specific disability that you can illustrate, or there's some other provisions. For example, if you can't vote on voting day or you're going to be out of town, etc., you can request a mail-in ballot. So allowing some people to vote by mail and a certain segment by age, and then not allowing the rest of the population to be able to vote by mail is straight up discrimination against the rest of the others that could vote by mail. You're basically telling a huge segment of the population, hey, you can vote by mail. And you're telling the other huge segment of the population, you cannot vote by mail just because. Okay, so that's what we have going on in Texas. But there are some other challenges that we should be aware of. One thing is, we saw in 2020 in Texas and around the country long lines where people had to wait 5-6 hours. And even when I ran in 2020, there were areas in my district, in Killeen and Temple specifically, that had long wait lines because the county officials decided to restrict the number of not just polling places, but the number of ballot boxes in each polling place, causing these kind of lines. So who does that impact in a very, very specific way? It targets people who normally normally have jobs that are hourly. So they're not able to they may be able to take 30 minutes, 45 minutes, maybe an hour for lunch. They don't have the ability to take off 6 hours in the middle of the day to be able to go and vote. So they may come in, stand in line for 40 minutes, and then they have to go back to work or an hour and go back to work. So if we want to solve these problems, we have to allow people to be able to take time off work to be able to vote, number one. Number two, we need to expand mail-in voting to include everyone, not just one segment, but to include everyone, because it's discriminatory towards the people that you're saying, hey, you can't vote by mail. So that's number two. And number three, we need to have distribution of polling centers and ballot boxes that looks at the population density. So if you have an area of town that's easily accessible, which has a high population density, you need to put more polling centers in that area. You need to put more ballot boxes in that area, ballot machines, right? Voting machines in those areas. So these are the things that we have to do at a state by state level. And why is this so important for Texas? Because if voting rights legislation does not pass at the national level, which seems it's very clear that Democrats want to pass it, but it's not going to pass. So it doesn't matter what you want to do. If you don't deliver for the American people, then the impact of what you want to do is essentially nothing. Saying, I would love to pass $15 an hour wage, but I can't get it done, right? So it's the same thing with voting rights. It would be great to pass, level the playing field to get voting rights passed at the national level, but we can't get it done. We can't deliver. So this challenge of not being able to deliver, I think, is the biggest challenge that Democrats are facing right now in Congress. And of course, this leads really well into our last item, which is the Biden poll. So today, there was a poll that came out, and President Biden's approval rating dropped to a new low of 33%. And of course, it's very clear that this poll is very much connected to what is going on with respect to controlling the virus, right? And the tool that this administration, as well as the last administration, has been focused on has been vaccines. And we saw that with a vaccine mandate that the administration wanted to do, of course, which got shot down today. But there are many, many different tools in fighting this virus. And we saw one of the tools, for example, testing, a huge lack of that. We also did not see a huge emphasis on things like KN95 masks, for example, being manufactured, or N95 masks being manufactured en masse. We didn't see, for example, early focus on therapeutics. So there are many, many different tools, and it would be good for the American people to be able to have the ability to use all these tools depending on which one works for them. Because remember, there are people who are unable to take the vaccine. There are for health reasons or medical reasons, for example. Now, there are very few, but we need to have all the tools available. We see right now, with respect to quarantining, people need to be able to test to know, do they actually have COVID-19, whatever variant that is, and we have a lack of testing. So there's definitely a lack of all the different tools being used, and using one tool only puts us at a disadvantage. So a lot of this approval rating is tied to COVID. But I want to come back to what the American people expect. Remember, the bottom 50% of our country is still struggling with basic economic needs. They still need to be able to have healthcare coverage. We have retirees on fixed incomes that literally cannot afford to get dental care. They cannot afford to get, vision, for example. Dental care can run in the thousands of dollars for things like crowns and root canals and implants. And even with dental insurance, and this is a very important point, even with Medicare and dental insurance, many seniors on fixed incomes, we're talking about teachers, we're talking about social workers, people who worked in nonprofit, people who worked their entire lives on salaries between $40,000 to $60,000, even people who live in Austin, Texas, are now having to juggle between healthcare costs, the cost of medication, food, and being able to pay their real estate taxes. So we have major challenges that the American people want Democrats to solve, because that is the Democratic Party platform. The Democratic Party is focused on helping out working families in the United States, but the bottom 50% of our country is struggling. Before the Build Back Better bill ever made it to the Senate, it was gutted with respect to Medicare expansion. It was gutted with respect to lowering the prescription drug prices in a big way. These are some of the most popular programs that the American people were hopeful for, right? Now you pair that with things like paid leave that was talked about. You pair that with tuition-free community college and the fact that the cost of education has gone up 3,000% over the last several decades. And then you're being handed this Build Back Better bill out of the House, gutted of tuition-free community college. Remember, it never made it to the Senate for the Senate to even consider. Not to mention DACA, TPS, completely off the table. The Build Back Better bill, even in its completely gutted form, does not have any pathway right now in the Senate. Now, what does that mean? That means we need leadership in Congress that will organize within Congress, that will bring people together, that will build consensus to deliver for the American people. Passing a bill in the House, as gutted as it may be, that does not pass in the Senate, does not help the American people. You can pass bills in the House all day long if you have a majority and you can agree on what are the contents of that bill. But if it does not pass in the Senate, then it does not become law and it does not impact and help the American people. We need leadership in Congress that are going to bring legislation that will pass in the Senate, that will collaborate to ensure that senators are going to vote for it. It is true that the Democrats have a very slim majority, literally one vote in the Senate, and they have a very slim majority in the House. But people will look back at this as Democrats have a trifecta in Washington. They have a majority in the House, they have the votes to get things passed in the Senate, and they have a Democratic president in the White House. So we need to get things done for the bottom 50% of the American people. And we have to deliver. And that is why it's important to send people to Congress that are going to not just co-sign legislation, not just vote and pass legislation in the House, but be able to pass legislation in the House that will also pass in the Senate. And this is why primary races are so important, because the most important decisions are being made in the Democratic primary to ensure that we have leadership in Congress that is competent and capable of getting things done and delivering for the American people. So with that, I want to close with a little bit about our race here in Austin, Texas. Texas has a fairly early primary election. And so our early voting starts in just 4 weeks. We're talking about February 14th is when early voting starts. Texas's 37th district is a brand new district. Texas got 2 brand new districts in addition to the 36 that they already had. Now, the conventional wisdom would have been if the GOP got 2 new districts, they would gerrymander them to make them both very, very red. But because of the population growth, specifically in Austin, Texas, that pushed Austin to become the 11th largest city in the country, and the population density in Austin, even though Texas was further gerrymandered, Austin, Texas, for the first time in decades, got a brand new Democratic-leaning district. And there is a primary in this completely open race. Texas's 37th district does not have an incumbent representative right now. So we have an election that's coming up on February 14th. There are 4 people on the Democratic ballot, including myself, and that race starts on February 14th. So if you're watching this, I have 2 requests for you. One is if you know anybody in Austin, or if you're watching this in Austin, please tell them about early voting. Tell them to come out and check out our campaign at votefordonna.com and decide to come out and vote in this election. It is an extremely important election. It is an opportunity for people in Austin to send a new representative that will champion legislation like Medicare for all, single-payer healthcare, scale the healthcare infrastructure to lower the cost of healthcare and improve the quality of care with more nurses and more doctors. It is an opportunity to send a new representative that will champion debt-free education and the elimination of student loan debt. And it can be done. We've talked about it extensively, both on my Twitter Spaces as well as on the YouTube video. It is an opportunity to come out and really send somebody to Congress that will deliver on the legislation that people in the district want to see. And it is an opportunity for Austin to come out and make your voice heard. This race will be decided in the Democratic primary because this is a Democratic-leaning district. That means in a primary, we have very low voter turnout. That means your vote has more impact in a Democratic primary than any other election that possibly can happen. So regardless of whether you vote in a Democratic primary or only in generals, this is a very important race for Austin itself. It's an opportunity for Austin, one that hasn't come to Austinites in a very, very long time. So with that, I want to thank you for supporting our campaign. The second part of this is if you are unable to vote in our campaign and you've told everybody in Austin about our campaign, please do consider donating to our campaign. We would like to get our message to every single voter, and trying to get our message to every single voter, whether that is by going door to door or getting a message to their door, it does have an expense associated with it. So we appreciate any kind of contribution you can make today. So with that, I want to thank you for your time today. I hope you enjoyed the stream, and we'll be back 7 p.m. Central Time next Thursday. And of course, if you want to talk directly to me, Twitter Spaces every 9 p.m. Central Time.